taking a public stance against racism. It's happening in cities, countries, and states all across the U.S. But what does it really mean for our communities? Nohalani Graff tells us more about the declarations and the organization in our state helping to lead the way.
Our Black and Brown communities do not have equal access to resources. They don't have equal access to economic opportunity or quality education. And all of these things, impact their overall well-being and health.
Amy Sitzler is the former president of the Arizona Public Health Association, the organization joining efforts to declare racism as a public health crisis. From governors to city councils to community groups, more than 160 in the U.S. have made the same declaration over the past year.
It was a really strong stance to say, we're standing against these systems of oppression that exist that have allowed many of us to have privilege and comfort, but then have negatively impacted our colleagues and community members to death.
During the COVID-19 pandemic, we've seen those racial disparities play out in our country.
When you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population.
African Americans are not the only group of minorities disproportionately affected. The cases among Native Americans also high here in Arizona. Legislation like the Anti-Racism in Public Health Act, proposed by members of Congress, would work with the CDC to break down barriers in healthcare.
They don't know what they don't know, and so they don't realize that they're not treating people equally or the same.
Dr. Tiffany McCullough works in emergency medicine. She says it's important for doctors and nurses to understand when treating patients of color, their life experiences matter.
They may not be the same as you, but those are things that as a physician, you are responsible for as well, if you're treating that patient.
The Anti-Racism in Public Health Act also taking a look at police brutality by creating a dedicated law enforcement violence prevention program at the CDC. Attorney Benjamin Taylor says the work is necessary.
A lot of these officers who are going through these crime scenes, they're already traumatized, they already have stereotypes, but they had more cultural training, more traumatic training to be able, more mental health training to be able to go to these scenes. They will be able to interact with people of color a little bit differently.
For some, the public health crisis declarations are just the beginning. Zariah Buchanan with the Arizona Public Health Association says words need to turn into effective action.
No matter what statements are put out, there's always action behind it. But making sure that action is not made from an ivory tower, but rather with the communities that are being affected is extremely important.
That was our Nohalani Graff reporting there. So what's next for the legislation? The Anti-Racism in Public Health Act is currently being reviewed by 2 committees in Congress before it goes up for a vote.